Colonoscopy can be an intimidating topic, but hopefully, after watching this video, you'll be reassured and have a better understanding of what's to happen. So let's start. You might be wondering what exactly a colonoscopy is. It is simply an examination of the large intestine using a colonoscope, a long, flexible tube housing a camera to check the health of your bowel. This procedure is often recommended by your doctor if you show symptoms such as tummy pain, bleeding or change in your bowel habit, or if someone in your family has a history of bowel cancer. Whatever the reason for needing a colonoscopy, you'll go through the same procedure. Although a colonoscopy is a straightforward examination, you still need to prepare yourself beforehand. You will need to take some medicine that will clean your bowel, which your doctor will provide for you. Don't forget to tell your doctor what other medications you're currently taking, if you have any existing medical conditions, or if you're pregnant. Once you have received all the information about the procedure, you will be given a consent form to sign. Now that you're ready, let's talk about what will happen during your colonoscopy. The first step is to decide whether or not you wish to be sedated. If you choose to have sedation, you will receive the medicine just before the procedure starts. You will feel relaxed and may even fall asleep. Whether or not you choose to be sedated, a needle will be inserted into your arm to give you medication. You will also be provided with oxygen. A nurse will be there to make sure you feel as comfortable as possible throughout the procedure. Once everyone is ready to begin, the specialist will insert the colonoscope into your bottom. This will be moved up the large bowel to where it meets the small intestine. It can be a bit uncomfortable as the scope works its way through. The colonoscope will then be slowly withdrawn. The doctor will have a close look at the lining of your bowel to see if there are any problems. If the specialist comes across anything that shouldn't be there, such as a polyp, they will take some samples, or if possible, remove it completely. The whole procedure usually takes between 20 minutes to an hour. After the examination, you will have a rest and recover quite quickly. If you were sedated, it may take between 30 minutes to 2 hours to fully recover. Without sedation, you're free to drive when you leave the hospital. If you did have sedation, legally, you are not allowed to drive for 12 hours. Make sure someone is picking you up from the hospital, driving you home, and staying with you overnight. Before you leave the hospital, you will be given some information about the procedure, what was found, and what the next steps are. A copy of this information will also be sent to your GP. You will be given contact details. Please telephone if you have pain, bleeding, or anything that worries you after returning home. If you feel it's urgent, go to the emergency department. A colonoscopy is generally a very safe and straightforward procedure. There are a few setbacks that can occur, such as an incomplete examination where the scope was unable to get all the way around the bowel. If this occurs, other tests can be done. On very rare occasions, tearing of the bowel lining can occur. If it does, you may need to stay in hospital to be monitored. In some cases, this may require an operation to fix the tear. This is very rare. During the procedure, polyps might be removed, which can cause some bleeding. If this happens, a small clip or injection can be used to stop the bleeding. You may need to stay for a little longer in recovery. These risks are rare, but you need to know that they are a possibility. A nurse will be with you shortly. If you have any questions, feel free to ask them.